We tried to do some literature search, and we were not able to find normal values for children, like how much should be the normal gray matter, white matter values in children. So did an exclusion criteria to identify which among these patients were clinically normal. So we ended up with about 170 or so patients with the age range all the way from 1 month old, 2 month old to a 21-year-old. So we were able to, using synthetic MRI software, quantify gray matter, white matter, CSF, myelin in all these patients. And we plotted them out, these quantitative values versus age. So now that we have the normal curves for our patient population, in future we intend to use these normative curves to identify abnormal patients. Like in a child, the white matter develops with age. Myelination happens as the child grows. There might be some situations where we are unsure whether it is normal or not. There, now that we have the normative curves, we can try to evaluate and put this patient's value alongside the normative curves and see if it falls within 2 standard deviations of this nomogram, if you say. And if it falls below or outside this range, this helps in better diagnosis and helps the radiologist prepare and answer the referring doctor accordingly. Especially in children where the brain is not so mature, as you say, the adult or the fixed TR and TE values may not apply to a 3-month-old or a 6-month-old or a 1-year-old versus the 18-year-old that we have. So SyMRI gives the benefits that we can now retrospectively, once the data is acquired, go back and change the echo time and TR time and generate a new contrast and see it at the console, or have this flexibility given to the radiologist to be able to do this at the monitor while they are just like used to changing the window level. Now they have the additional feature of also being able to change the TR and TE and TI time in case of flare. So that's a huge benefit in addition to the quantitative maps that get generated. And the other benefit is the benefit of having T1, T2 PD maps. So we intend to use that in tumor situations where if you have a patient with a tumor, we now have the ability to measure T1, T2 values, and if the patient goes through a chemo or a treatment regime, of course, if the radiologist is able to visually see it, that's great. That's all. But some situations where there may be a change which may not be visually as clear, we can now measure the T1 and T2 values and see if there is any change that's happening quantitatively, and that might help to benefit the patient follow-up as well. I think it's really a very nice acquisition sequence and the post-processing software, giving the ability to get these contrasts, 8 different kind of contrasts back, and being able to change the TR, TE, TI values Additionally, you get quantitative maps that have T1, T2, PD maps, gray matter, white matter, CSF, and myelin. So you get a huge value return for the amount of time that's spent to acquire the sequence.